Hello and welcome to today's video where we will be discussing a highly debated topic in the UK, the privatization of the National Health Service, NHS. The NHS is a publicly funded healthcare system established in 1948 and has since become an iconic symbol of the UK's welfare state. But in recent years, there have been discussions about whether privatizing the NHS would lead to better outcomes for patients and the healthcare system as a whole. In this video, we will be taking a closer look at the pros and cons of privatizing the NHS. We will be exploring the background information on the topic and examining both sides of the argument to help you form your own opinions. Whether you are a healthcare professional, a patient, or just someone who is interested in the topic, this video will provide you with the information you need to understand the current debates surrounding privatizing the NHS. So, sit back, relax, and let's dive in. Privatization, in general, refers to the transfer of ownership and control of a public service or asset from the government to the private sector. In the context of the NHS, privatizing would mean transferring some or all of the healthcare services currently provided by the NHS to private companies. The debate surrounding privatizing the NHS has been ongoing for several decades. However, it has gained more traction in recent years due to funding issues faced by the NHS and the increasing demand for healthcare services. The Conservative government has implemented a number of reforms aimed at increasing private sector involvement in the NHS, including the creation of private providers and the introduction of market competition. Currently, the NHS operates as a publicly funded system, which means that funding comes from taxes and national insurance contributions. The NHS provides a comprehensive range of healthcare services to the UK population, including hospital treatment, GP services, mental health services, and community healthcare. The NHS is known for its universal access, free at the point of use, and its commitment to providing high-quality care to all, regardless of their ability to pay. While privatizing the NHS has its supporters, it also has many opponents who argue that the NHS is a public good that should not be subject to market forces. The debate on privatizing the NHS is complex and multifaceted, and it is important to consider all sides of the argument to fully understand. Pros of privatizing the NHS. Increased efficiency and innovation. Proponents of privatizing the NHS argue that private companies, driven by the profit motive, would be more efficient and innovative in providing healthcare services. This could lead to better patient outcomes and reduced waiting times. Better quality of care. Privatizing the NHS would encourage private companies to compete with each other, leading to an improvement in the quality of care. Companies would be incentivized to invest in new technology and better facilities to attract patients and stay competitive. More competition and options for patients. Privatizing the NHS would increase competition among private providers, providing patients with more choice and flexibility when it comes to their healthcare. This could lead to greater patient satisfaction and improved health outcomes. Cons of privatizing the NHS. Accessibility issues for low-income and marginalized communities. Privatizing the NHS could result in reduced access to healthcare for low-income and marginalized communities who may not be able to afford private healthcare. This could exacerbate existing inequalities and result in a two-tier healthcare system. Higher costs for patients and increased inequalities. Private healthcare is often more expensive than publicly funded healthcare. Privatizing the NHS could result in higher costs for patients and increased inequalities, as those who can afford private healthcare will receive better quality care than those who cannot. Potential for decreased accountability and quality of care. Private companies are motivated by profit, and this could lead to a reduction in accountability and quality of care. Companies may prioritize financial considerations over patient welfare, leading to reduced standards of care. In conclusion, the debate on privatizing the National Health Service, NHS, is complex and multifaceted, and it is important to consider all sides of the argument to fully understand the implications of this policy change. On the one hand, privatizing the NHS could lead to increased efficiency, better quality of care, and more competition and options for patients. On the other hand, it could result in reduced accessibility for low-income and marginalized communities, higher costs for patients, and decreased accountability and quality of care. In making a decision on whether or not to privatize the NHS, it is important to weigh the pros and cons and consider the impact that this policy change would have on the UK's healthcare system and its patients. So, that's it for today's video. I hope you found this information useful and that it has helped you better understand the debates surrounding privatizing the NHS.